Hi everyone, my name is Sabrina Caballero and this is my oral presentation on ICU nursing. This is going to be for my Introduction to Healthcare Sciences class. So without further ado, my introduction is going to be the exploration of critical care nursing. Starts off with why I chose the career. I chose it because when I became a mother, I became increasingly interested in healthcare, especially learning about how to take care of my child in emergency situations. It led me to do a basic life support certification and just eventually put me on a path to want to go back to school to become a nurse. We'll also go over all the topics from our career exploration paper in this presentation as well. So we'll start off first with the core responsibilities of an ICU nurse. You will definitely need to understand how to do rapid assessments and monitor critical trends, say like an ECG, different vitals, and then obviously the blood values, so your calcium, your hemoglobin. You'll need to know all the values that are in normal range, blood pressure, all that stuff. You need to be able to manage ventilators and IV drips. You need to be able to interpret arterial blood gas lines, and then know how to use sterile technique for insertion of catheters, central venous lines, all of that. Those have high infection rates, so it's important to know how to be sterile and the proper procedure. And then we also have provide continuous compassionate care because it's a stressful situation when people are in the ICU, so you need to know how to handle it. And then an example and insight, 5 million people a year are admitted into ICU, so it's a pretty common thing. Most people have somebody in their lifetime that they will know that goes into an ICU or themselves. Communication and ethical practice is essential in all nursing, also in ICU nursing. So you need to know how to collaborate with other professionals like doctors, respiratory therapists, pharmacists, and people that are even below you like LPNs and CNAs. Understand their scope of practice and what you can ask them to do, and then your own role and what you're allowed to do, as well as communicate effectively during shift changes and just patient information. You'll need to be able to understand the 5 C's, which is compassion, confidence, competence, commitment, and conscience. Understand how to comply with HIPAA and patient privacy. You need to be able to communicate honestly, even if the information is hard for the patients or family to hear. And then insight, 20% of all medical malpractice suits have at least one documentation error. So written communication error. Education, licensure, and certifications are going to be for the ICU a minimum of an associate's degree, but it is preferred to have a BSN. You obviously need to pass the NCLEX RN examination. You need to have your CEUs, which is 28 in Florida, 30 in Pennsylvania, for example, but they vary depending on the state. And then you're required to have a BLS and an ACLS certification. It is recommended after a year to pursue the CCRN certification, and some people pursue the PALS or the TNCC for trauma. So the academic pathway for nursing, I put, for example, the Miami-Dade ASM program. So it's broken into semesters where you'll have clinical rotations. You rotate through medical surgical units, pediatrics, obstetrics, psychiatry, etc., ER. And then you also have classes on community health and leadership. So those are for the, and then you'll have lectures also too with written tests. Second one is going to be on the pathway through a BSN. It matters because it's a highly competitive field to get into the ICU, and you want as much upper edge as possible, as well as the opportunity to have just more knowledge to be able to move forward through your degree and also provide excellent care for your patients. It builds a foundation if you're interested in going into graduate programs as well. Internships for the ICU are really important. Most people do them. They have them at most of the major hospitals. For example, I listed the ICU internship at Mount Sinai. This is currently listed, but I've checked many times over the last 2 years. They're pretty much always accepting people for the ICU. It is competitive. I believe they would look at grades and they would be very selective, but they have them at Jackson, they have them at Baptist, and many other places. So they're recommended to go into these more difficult and like competitive professions in nursing. So you can also do volunteer work to kind of boost your resume to get into the ICU, especially if you're lacking some previous medical, like healthcare employment, like you haven't worked as a medical assistant or you haven't worked as in the hospital at all. So these are good. You can work at you can volunteer at different community health organizations. They have free clinics. Just something to put yourself on the resume that can kind of relate to your new field. I also put the Army Reserve Nurse Corps as an opportunity for nurses, ICU nurses, because it can also be something that you can do after. It's not really exactly pertaining to this slide, but it's something that's on my path for nursing. I plan on joining it. So I wanted to put some information on it because it can give you tuition assistance, especially if you're looking in graduate programs and BSN. Employment outlook is excellent. There's a lot of career growth. I have a little bar graph on the different ICU salaries by location. These are just locations that pertain to me. So I have Washington, D.C. right over here where I'm originally from. This has the highest median salary of $134,000 a year. The lowest is Florida at $70,000 a year. There's also career advancement opportunities. You can go into the CVICU or the neuro ICU if you want to specialize, or you can apply to graduate school, like becoming a CRNA or an NP. CRNA school definitely prefers people from the ICU. This was the reason one of the reasons I chose to pursue the ICU, because I would like to apply to CRNA school eventually, and this is the best way to get admitted from an ICU unit. Oh, and an example of the insight is that between 2022 and 2034, the job growth is projected to grow 6% in ICU nursing. This is a reflection of the interview I had. I had it with Brittany Egberts. She works in St. Luke's Hospital in Easton, Pennsylvania. She's been there for 10 years in the ICU. She said the most rewarding part of ICU nursing is when you see really sick patients go home, and the hardest part is when they don't make it. So the insights were going to be able to detect subtle changes and prevent emergencies. Having a strong academic background in anatomy and physiology. Medical math is important too. You want your BLS, ACLS, you want your certs. You want to be able to communicate and be able to work as a team. You also need compassion and empathy when you're working in nursing. And then we have professional pathways and networking, or professional organizations like the American Association of Critical Care Nurses. That's a national one, and then there's also state ones like the Florida Nursing Foundation, and then I also have the Pennsylvania Nursing Association. So yeah, these are just highly recommended because they give you access to journals, clinical trial information, just relevant new developments in medicine and in healthcare. So, and networking events to meet other professionals, which is always good. The 5-year plan, I used AI to do it. So it was great. It outlined everything I would need to do to become a ICU nurse and even apply to grad school as a CRNA. Gave me my CEUs, expectations, grades I would need to go for, classes. It also gave me stats, job postings, and I fact-checked everything, and it was fairly accurate. So it definitely was a useful tool, something great about 2025. And then my conclusion, just overview throughout the presentation. I covered all the topics, the main ones about becoming an ICU nurse. It was a great presentation and paper to do because we really got a good insight into what our future careers are going to be. My personal reflection is I'm very excited to be able to learn how to take care of the very sick people and make a difference in people's lives. I also added a little quote from a book that I love. It's on a biography of cancer by Susan Sontag, and then it has life, sickness is the night side of life. The more honorous citizenship, everyone is born, who's born holds dual citizenship in the kingdom of the well and kingdom of the sick. So don't take your health for granted, you know, and yeah, it's something that sickness and healthcare and hospitals, all of it pertains to everybody. So everybody's sick at some point, and it's going to be great to be able to become a nurse and be able to help people during a difficult time in their life. So I have my references right over here for you guys to go over, including all of what I used for factual information and the textbook for the class. So thank you so much for listening to my presentation, and I hope you learned something about ICU nursing. I know I definitely did as a student just doing it. So anyways, thank you.